Good morning, everyone. My name is Alan Vidara, and I'm here on behalf of Positive Reach HIV Support and AIDS Prevention Group. My partners in this small helping group are Elena, Kyle, and Michael that will be joining us on the live presentation tomorrow. What I would like to introduce about ourselves is that we are a small group based in South Florida. We help people that have contracted the HIV virus in order for them to live a happy and productive life and not develop AIDS. Our sponsors are very limited right now, and that's why we're here looking for new ones. Our main sponsor is the LGTB community that has been helping us since this was a little idea, and it has developed into this moving office that we have today. Our main goal, as I said before, is to reach the most individuals in our community, for them that are tested positive for HIV, for them to live a healthy and happy lifestyle and try to stop the developing of AIDS AIDS virus for the longest possible. We are planning to copy this system. In order to make it globally, we need to reach more people. We started in South Florida due to the fact that it's the high percentage of new HIV infections are here in our South Florida community. Our patients, since day one that they walk into our office, are most of them uninformed of the impact that of what testing positive actually means. So we guide them through an orientation, and we explain them that if there is definitely something to take in consideration, there is nothing that they cannot overcome. We try to help them, guide them, inform them the most we can, and we refer them to many of the physicians that work directly with us. And they also go through a classification for income possibilities. There are different group classifications for different income bases, and the key to success is mostly that we're trying to keep our company as a family. We try to reach them, help them keep their private lives. It's keeping their privacy is very important for us, and we always do this as a group. And as you might know, groups tend to succeed more often. Our mission right now in the South Florida area is to provide free HIV testings for all the individuals that walk into our office. We provide them also with information to stay healthy and how to reduce risky behaviors that will continue their illness, and how to control the virus not to spread. We try to let them know that they will have to be disclosed. They have to be disclosing this information with their new sexual partners, and trying to control the epidemic that actually exists. We will focus on keeping them happy, healthy, and AIDS-free. And now I would like to introduce Elena that will explain more further all the negative aspects of living with HIV. Thank you.
Thank you for being here. The statistics, the U.S. statistics, according to the Center of Disease Control and Prevention, 50,000 people, 55,000 people will get infected of HIV this year. Around 1 million are living with HIV. 1 out of 6 people don't know they're infected. 1 out of 4 are young people in the ages of 13 and 24. The race and ethnicity. 44% are African Americans, the most incidents in 44 in African Americans. 31% are whites, 21% are Latinos, and the 4% are others. There is less incidence in women than men, but the case of women is terrible because there are pregnant women that can make the contact with the babies once they haven't been coming to life. Forget it. These statistics tell us that it's a problem. Florida ranks third in the nation of incidences of cases of HIV. But what is HIV? HIV stands for immunodeficiency virus, and once we get it in our body, it stays forever. Unless other viruses that we can get rid of, this virus stays and destroys our cells. There are two stages. One stage is the acute infection, where patients probably cannot feel any symptoms. And in this stage, the virus destroys our CD4 cells or T cells and spreads very fast. If it goes to the second stage without treatment, it goes more chronic. And that way, HIV will spread in a higher level, and that will be very dangerous. If at this point, if at this stage, we receive the treatment, the ART, the antiretroviral therapy, we will have a patient that can live a lifetime, almost a regular lifetime. Since 1990, the cases, people were surviving less than a decade with this problem. Now, thanks to this therapy, people are living almost normal. But if they want to live almost normal, they have to go to institutions like us so we can help you in a way that you get treatment and in a way that you can progress with us. Because we not only work with the patient, we work with the family. After I saw an interview and little overview about what HIV is, there are ways that you can get infected. We probably only know about sexual contact, but there are other ways that are very scary, like with injection drug use, like in the pregnancy childbirth that I mentioned previously, with breastfeeding, occupational exposure, blood transfusion and organ transplant, and blood and human body fluids. When this mother is pregnant, and sometimes it's a young mother is pregnant and does not know she is infected, the baby more likely will have the virus. There are cases that these young girls don't tell the parents they're pregnant, and they don't go to get tested, and the problems get bigger. Since if it's in the 10 weeks, during the frame time of 10 weeks, if she gets in treatment, and when she gives birth, she avoid the breastfeeding, the baby can be safe. I am very happy to see all the success that we have been having this year and and we have goals to increase the efficiency. And there are many ways that the community can help us. The reason we're here is to bring support to our patients, and I ask you to donate and make us continue working on this, which is very, very important. Thank you. And here is Kyle.
Okay, so now that we understand a little bit more about the HIV virus and how it's contracted and all these statistics, we understand how to also deal with this virus and help these individuals who are HIV positive live a better life. So there are several ways to treat HIV because there are several aspects of the human body that the virus affects. For instance, you are infected with the HIV virus, it slowly starts destroying your cells. So antiretroviral therapy, as she mentioned before, is it's crucial for dealing with and helping individuals with this virus. Because without this treatment, the individuals this HIV will progress into AIDS. So this treatment is very important, but there are also several other important ways that we deal with HIV virus. And one is nutrition. Nutrition is very important because a lot of one of the effects of HIV is malnourishment, where individuals will be very, very thin and underweight because of the virus. So it's very important to eat healthy and eat the right foods. For instance, it's important to eat low sugar and low carbs. I'm sorry, high carbs and a lot of lean protein. And it's also important to eat the food relative to one's own body weight. This is because people are underweight, so it's important to eat as much as your body needs to sustain and fuel itself. So another aspect of the human body that the virus affects is our mental health. A lot of the time, just having HIV, it's a very sad circumstance that affects individuals, and a lot of the time it can cause depression as well as a bunch of other mental conditions and disorders. And this is very bad because individuals can forget, when to take their medication or that they have appointments and things like that. So it's important to also keep up with their mental health as well as their physical being and their nutrition. So what our company can do to help these individuals and treat them is our facility doesn't directly treat these individuals, but rather it serves as a medium between our connections and these patients. So what we will do is we have a vast network of parties that can help these HIV positive individuals, ranging from doctors to nutritionists to psychologists and counselors to help these people with all the symptoms of their disease and everything negative that comes with it. So what our company does is we keep track of these individuals. We'll drug test them for free in our facility. Then once we've confirmed that they're positive, test them, HIV test them. And once we confirm that they're positive, we will keep track of them. We create a file for them, and we'll send them to whoever they need to be in contact with in order to receive treatment. So this ranges from doctors to receive antiretroviral treatment, to nutritionists who can help create a diet plan for them, and as well as psychologists and counselors, because you need to talk about a lot of the time your problems, and this not only affects the patients as well as their families. So it's important to receive counseling and all these psychological treatments. So now Michael is unfortunately not here, so Michael would talk about financing this and how much money we need to create our facility and to sustain our business. He would conclude our presentation. So, thank you very much.
Thank you.